Welcome to Part 2 of Dependent Adult Abuse for Mandatory Reporters. This section of the course will cover recognizing abuse. Let's get started. Part 4. Recognizing abuse. This section is designed to help mandatory reporters spot abuse or neglect as early as possible and to know which type of abuse to report. There are a number of victim and abuser behaviors which may indicate the presence of abuse or other serious problems. An awareness of the common indicators will assist a potential reporter in recognizing the situation. Behavioral indicators of the victim include fear, withdrawal, depression, helplessness or resignation, hesitation to talk openly, unbelievable stories, agitation or anxiety, confusion or disorientation, ambivalence or contradictory statements that are not due to mental dysfunction, anger, denial, non-responsiveness. Behavioral indicators of the abuser include the victim not being allowed to speak for him or herself, an obvious absence of needed assistance, attitudes of indifference or anger toward the victim, the caretaker blaming the victim, aggressive behavior, a previous history of abuse, problems with alcohol or drugs, flirtations or coyness, conflicting accounts of incidents by the family, supporters, and the victim, non-compliance with service providers in planning for care and implementation, and the withholding of security and affection. Observation of just one indicator may not cause a potential reporter to suspect abuse, but a combination of the indicators may reveal a serious situation. The potential reporter may want to question further, document the situation for future use, or make a report. The following sample case illustrates how one can spot abuse through interaction with the victim and the abuser. Maxine was a regular customer at the bank and was well known by the tellers and other personnel. She had a sunny personality and always enjoyed her visits to the bank. Maxine had a period of absence from the bank due to a stroke. When she returned, she was accompanied by her grandson. Unlike her previous demeanor, Maxine now was withdrawn and anxious, and her grandson handled the bank business for her as if Maxine were not there. Several staff at the bank greeted Maxine and asked about her health since she had not been in for her regular visits. Maxine was hesitant and vague in her reply. After she left, the tellers all expressed their concern and wondered about the change in Maxine. Physical abuse involves the willful or negligent acts or omissions of a caretaker that result in one or more of the following: physical injury to a dependent adult, injury to a dependent adult which is at variance with the history given, assault of a dependent adult, unreasonable confinement of a dependent adult, or unreasonable punishment of a dependent adult. An assault is committed by a caretaker when, without justification, the person does any of the following: any act which is intended to cause pain or injury to, or which is intended to result in physical contact which will be insulting or offensive to another, coupled with the apparent ability to execute the act. Any act which is intended to place another in fear of immediate physical contact, which will be painful, injurious, insulting, or offensive, coupled with the apparent ability to execute the act. Intentionally pointing any firearm toward another or displaying in a threatening manner any dangerous weapon toward another. An act shall not be considered an assault when the person doing the act and the other person involved are voluntary participants in a sport, social, or other activity that is not in itself criminal and the act is a reasonably foreseeable incident resulting from that sport or activity, and it does not create an unreasonable risk of serious injury or breach of the peace. It is important to remember that there does not have to be an injury to constitute physical abuse. Personal degradation means a willful act or statement by a caretaker intended to shame, degrade, humiliate, or otherwise harm the personal dignity of a dependent adult, when the caretaker knew or reasonably should have known the act or statement would cause shame, degradation, humiliation, or harm to the personal dignity of a reasonable person. Personal degradation also includes the taking, transmission, or display of an electronic image of a dependent adult by a caretaker when the caretaker's actions constitute a willful act or statement intended to shame, degrade, humiliate, or otherwise harm the personal dignity of the dependent adult. Personal degradation does not include the taking, transmission, or display of an electronic image by a caretaker when it is in accordance with the facilities or program's confidentiality policy and release of information or consent policies. Physical indicators of abuse include an injury that has not been cared for properly, any injury incompatible with the resident's history, pain on touching, cuts, lacerations, or puncture wounds, dehydration and/or malnourishment without an illness-related cause, weight loss, pallor, sunken eyes or cheeks, burns, eye problems, retinal detachment, absence of hair or hemorrhaging below the scalp, soiled clothing or bed, being locked in a room, lack of bandages on injuries or stitches when indicated, evidence of unset bones, heavy or excessive medication. Sexual abuse means the commission of a sexual offense with or against a dependent adult as a result of the willful or negligent acts or omissions of a caregiver. Sexual abuse includes the following subcategories: first, second, and third degree sexual abuse, detention in a brothel, indecent exposure, assault with intent to commit sexual abuse and incest, invasion of privacy or nudity. Sexual exploitation by a caretaker means any consensual or non-consensual sexual conduct with a dependent adult for the purpose of arousing or satisfying the sexual desires of the caretaker or the dependent adult, and that occurs in a healthcare facility. This includes, but is not limited to, kissing, touching the clothed or unclothed inner thigh, breast, groin, buttock, anus, pubis, or genitals, or a sex act. Sexual exploitation also includes the transmission, display, or taking of electronic images of the unclothed breast, groin, buttock, anus, pubis, or genitals of a dependent adult by a caretaker for a purpose not related to treatment or diagnosis, or as a part of ongoing assessment, evaluation, or investigation. Sexual exploitation does not include touching which is part of a necessary examination, treatment, or care by a caretaker acting within the scope of practice or employment of the caretaker, exchange of a brief touch or hug for the purpose of reassurance, comfort, or casual friendship, or touching between spouses. Indicators of sexual abuse and exploitation include drastic changes in behavior such as acting out or lashing out, having inappropriate affect, depression or symptoms of other mental health issues, being fearful in a caretaker's presence, preferring not to be alone with the caretaker, genital or anal bruising, vaginal or anal bleeding, swelling or redness of the genital area, sexually transmitted disease. The look and feel of physical, sexual, and mental abuse in a healthcare facility may present as direct abuse from staff or sometimes an intruder or visitor from outside. It may include striking, pinching, shoving, pulling, and various forms of sexual abuse. It may also present as psychological or emotional abuse, such as ignoring, ridiculing, cursing, inappropriately restricting mobility, and name-calling. The look and feel of physical, sexual, and mental abuse in a healthcare facility may also present as substandard health and personal care resulting in abuse. Examples include incorrect or inappropriate use of restraints, both physical and chemical, which often result in immobilization, involuntary seclusion, incontinence, dehydration, pneumonia, cardiovascular stress, pressure sores, and psychosocial trauma. Financial exploitation means the act or process of taking unfair advantage of a dependent adult or the adult's physical or financial resources for one's own personal or monetary gain without the informed consent of the dependent adult. This includes theft. It is accomplished by the use of undue influence, harassment, duress, deception, false representation, or false pretenses. It results from the willful or negligent acts or omissions of a caretaker. Financial exploitation may be indicated when the dependent adult becomes inaccurate, confused, or has no knowledge of their finances, or turns over financial affairs to someone in exchange for lifelong care, but does not appear to have the basic necessities, such as food and shelter. Financial exploitation might also be suspected when there is disparity between the dependent adult's income and assets, lifestyle, and/or living arrangements. Bills remain unpaid when resources should be adequate. The signature on checks doesn't match that of the dependent adults. There is unusual activity in bank accounts. Financial exploitation might also be indicated if the caretaker expresses unusual interest in the amount of money being expended for the care of the dependent adult, is evasive about financial arrangements, or begins to handle the dependent adult's financial affairs without consent or consultation or without a legal relationship. Examples of misappropriation of property or money in a facility include the resident's loss of valuable property, refusal of the individual controlling the money to spend money on the resident's care, the resident's placement not commensurate with the alleged size of their estate, there are unpaid bills and overdue payments to the facility, there is a recent will, although the resident is clearly incapable of making a will, or there is a recent power of attorney or voluntary guardianship even though the resident is incapable of understanding or consenting to these legal relationships. Denial of critical care means the deprivation of the minimum food, shelter, clothing, supervision, physical or mental health care, or other care necessary to maintain a dependent adult's life or health as a result of willful or negligent acts or omissions. This condition can be the result of caretaker neglect or self-neglect. Denial of critical care includes the following subcategories: denial of or failure to provide adequate food, shelter, clothing, medical care, mental health care, denial of or failure to meet emotional needs necessary for normal functioning, provide proper supervision, provide adequate physical care. It is important to remember that individuals have the right to self-determination. Our disagreement with a resident's lifestyle does not necessarily indicate self-neglect. Signs of neglect in the community include a pattern of failure to provide adequate food, malnourishment, no food in the home, food contamination or spoilage, lack of clothing to adequately provide protection from the weather, lack of heat, unsanitary or hazardous conditions, a refusal to provide medical evaluation for conditions detected by medical personnel. Day-to-day neglect is an accumulation of intentionally or unintentionally neglectful practices. Examples of neglect in a facility include incorrect positioning, which can lead to fractures and skin breakdown, the failure to provide adequate liquids, which can lead to dehydration, allowing a resident to sit in urine and feces, which causes skin breakdown, lack of assistance with eating, which leads to malnutrition, poor hand washing techniques, which leads to infection. Everyone is not always in a position to directly observe all the indicators for the different types of abuse, but medical personnel are more likely to be in a position of observing indicators of physical or sexual abuse due to their medical knowledge and physical access to the victim. Bank or financial personnel are more likely to observe indicators of financial abuse. However, anyone that has regular contact with a dependent adult can be in a position to recognize abuse through their relationship with the victim over time. Congratulations! You have completed Part 2 of Dependent Adult Abuse for Mandatory Reporters. When you're ready, continue on with Part 3, and when you have completed the entire course, you will be able to take the quiz.